हेलो फ्रेंड्स, आज हम लोग एंटी पार्किंसोनियन ड्रग्स के बारे में पढ़ेंगे। सबसे पहले क्लासिफिकेशन ऑफ एंटी पार्किंसोनियन ड्रग्स। फर्स्ट, ड्रग्स अफेक्टिंग ब्रेन डोपामिनर्जिक सिस्टम। सेकंड इज ड्रग अफेक्टिंग ब्रेन कोलिनर्जिक सिस्टम। ड्रग अफेक्टिंग ब्रेन डोपामिनर्जिक सिस्टम में सबसे पहले डोपामाइन प्रीकर्सर, जिसके अंदर आता है हमारा लेवोडोपा। सेकंड इज पेरिफेरल डीकार्बोक्सिलेज इनहिबिटर, जिसमें कार्बिडोपा बेंजोडाइजाइड आता है। थर्ड वन इज द डोपामिनर्जिक एगोनिस्ट, जिसमें ब्रोमोक्रिप्टिन, प्रोपिनिडोल, प्रेमिपेक्सोल आता है। नाउ MAO-B इनहिबिटर, जिसमें सेलेजिलिन, रेसिजिलिन आता है। कॉम्ट इनहिबिटर के अंदर इंटेकापोन, टॉलकेपोन आता है, एज वेल एज डोपामाइन फैसिलिटेटर, जिसमें MNTD। नाउ ड्रग अफेक्टिंग ब्रेन कोलिनर्जिक सिस्टम, जिसमें सेंट्रल एंटीकोलिनर्जिक्स है, जिसके अंदर ट्राइहेक्सिफेनिडिन, प्रोसाइक्लिडिन, पिपेरिडिन आता है, एंड एंटीहिस्टामिनिक में ऑर्फेनड्रिन एज वेल एज प्रोमिथाजिन आएगा। नाउ लेवोडोपा का सबसे पहले मैकेनिज्म ऑफ एक्शन देखते हैं। 1% of levodopa crosses the blood-brain barrier. Now levodopa brain में गया। अब इस ब्रेन में taken up by surviving dopaminergic neurons. Now levodopa कन्वर्ट हो गया डोपामाइन में, किसकी मदद से? डोपा डीकार्बोक्सिलेज की मदद से, और डोपामाइन लास्ट में रिलीज एज अ न्यूरोट्रांसमीटर। Actions of levodopa in CNS: it improve hypokinesia, rigidity and tremor. It normalize posture, gait, handwriting, speech, facial expression, mood, etc. Cardiovascular में it causes tachycardia as well as postural hypotension. Chemoreceptor trigger zone में elicits nausea as well as vomiting. In endocrine, inhibit prolactin release, inhibit growth hormone release. Pharmacokinetic of levodopa: it is rapidly absorbed in small intestine for fast metabolism in GI, mucosa and liver. About 1% of administered levodopa crosses the blood-brain barrier. Now, adverse effects of levodopa are nausea, vomiting, postural hypotension, alteration of taste sensation, prolonged therapy, behavior effect, abnormal movement, fluctuation in motor performance. Uses of levodopa is in Parkinsonism. Levodopa is used with the mixture of 250 mg of levodopa plus carbidopa 25 mg. Now, carbidopa. It is a peripheral decarboxylase inhibitor. Mechanism of action: carbidopa do not cross blood-brain barrier as levodopa does, and do inhibit peripheral conversion of levodopa to dopamine in the brain, and indirectly increases dopamine concentration. Uses: combination with levodopa, it is also called careldopa. It is a first-line anti-Parkinsonian drug. Levodopa must be used in combination with peripheral decarboxylase inhibitor. This peripheral decarboxylase inhibitor inhibits the peripheral conversion of levodopa to dopamine and indirectly increases dopamine concentration in brain. Also increase efficacy of levodopa, reduce toxic effect of levodopa. Now, benefits of combination of levodopa and carbidopa. First, plasma half of levodopa is prolonged and dose is reduced by 1/4. Systemic concentration of dopamine is reduced. Nausea, vomiting are not prominent. Cardiac complications are minimized and improvement rate is higher. These are the benefit of combination of levodopa and carbidopa. And the combination is given in the form of 250 mg of levodopa plus 25 mg carbidopa. Now we came to dopaminergic agonist. Bromkriptine, mechanism of action. It is a potent agonist on D2 receptor but partial agonist or antagonist on D1 receptor. Adverse effects are vomiting, hallucination, hypotension, conjunctival infection. Usage: it is used supplement to levodopa to improve control and smoothen on-off fluctuation in Parkinsonism. Now, ropinol as well as pramipexole. Mechanism of action: it is a selective D2 as well as D3 receptor agonist. Their adverse effect are nausea, vomiting, hallucination, hypotension, conjunctival infection. Usage: it is both used as monotherapy for early Parkinsonism. Or ropinirole, it is used in restless leg syndrome. Now, MAO-B inhibitor, selagiline. Mechanism of action: it is a selective and irreversible MAO-B inhibitor. Reduce metabolism of dopamine to dihydroxyphenyl acetic acid. Their adverse effect: postural hypotension, nausea, confusion, psychosis. Use as it is used with levodopa. It prolongs levodopa action. It attenuates motor fluctuation. Entacapone. It is also an COMT inhibitor. Mechanism of action: selective, potent, and reversible COMT inhibitor. COMT means catecholamine O methyl transferase. Inhibit metabolic pathway of dopamine. Adverse effect: diarrhea and yellow-orange discoloration of urine, nausea, vomiting, postural hypotension. Uses: it enhance and prolong the therapeutic effect of levodopa, carbidopa in advanced cases of Parkinsonism. Thank you. That's all about anti-Parkinsonian drugs.